We've all had to stick out our tongues when seeing the doctor. It's the same at this clinic in Beijing. But the patient isn't sitting in the doctor's office. He is in Guizhou province in southwest China, more than 2,000 kilometers away.
能看到说用户的这个就医的相关行为已经在线上迁移的这个趋势是非常明显。
363 million people had used internet-based medical services in China by the end of 2022.
The government is trying to encourage more usage of the online healthcare system to better supplement its traditional hospital ones. And it has been very effective because now the traditional public hospitals can acknowledge the prescriptions or the diagnosis from the internet hospitals, and they can share some of the data or even some of the patients together.
An internet hospital is usually an online addition to an existing hospital, healthcare provider, or even a services platform. Besides teleconsultations, patients can manage appointments and renew prescriptions. The first such hospital was set up in 2015. At the close of 2018, there were just over 100 internet hospitals in China. By June 2021, there were more than 1,600.
First is the major hospitals, because of the pandemic and all, the major hospitals established their own online presence, their own online or internet hospitals. The second is the internet companies like Alibaba, Jingdong.com. They obtained this third-party public hospital license, and then they built a platform attracting and inviting the hospitals, doctors, and the patients to join their platform, use their service, and take service fees out of it. And I think the second one is going to attract more attention and the traffic, since the Alibaba and the JD.com have the technology and AI capability to provide a secure and intelligent service platforms. So if it's very easy to use and it's very valuable service, then it's going to attract more patients online in the future.
Changes in government regulations have further opened up the online hospital ecosystem. Direct online sales of prescription drugs are now allowed, and medical insurance payouts can now be made to online hospitals. In 2021, China also adopted its first ever digital privacy law. It aims to enhance data protection amid this wave of digital transformation.
我们一直认为互联网医院的质量和安全是我们整个医院开展的生命线，所以在过往我们一直通过依靠京东金融级的数据安全的保障体系去保障我们整个用户数据包括隐私的安全。
With the application of artificial intelligence on internet hospital platforms, patients may be able to complete multiple procedures at one go, instead of having to make several visits to the doctor. Follow-up treatments and rehabilitation can also be conducted online. This means a closed loop for patients, saving them time.
For example, if I tell an AI chatbot on the app what the symptoms I am having, and then it will give like a very intelligent assessment based on the symptoms and self-diagnosis function as well. And also for some chronic disease patients who needs to visit the hospitals regularly to fill their routine prescriptions, they can simply, using the app and auto-fill the prescriptions that was the same before, and then get it delivered to their home without going to the hospital.
设想这个情况，我们会发现它其实是对于医患资源的一个更加高效率的匹配，同时是对于患者就医流程效率的一个和体验的大幅提升，也是对医生职业效率的大幅提升。
Dr. Liza is a dermatologist who used to work in a public hospital. He made the switch to online medical diagnosis 5 years ago. In person, he used to see about 30 to 50 patients a day. On a digital platform, that number jumps to as many as 260 a day.
相比传统医学来说呢，它最主要有2方面。第一是没有时间的限制，像我们呢问诊的是提供24小时服务，就是24小时呢医生都有在线解答患者的问题。另外一个没有地域的限制不管你身在何处呢，都可以通过手机 app 呢上线问诊。
全国差不多400多万的医生，我们现在初步看起来，至少有10%到20%的医生都在拥抱线上执业的方式。所以从政策到行业的变化，到疫情之后用户大众认知的变化，这些都在潜移默化的静水流深的去改变着整个医疗体系，也让大家更加拥抱互联网医疗的新的方式。
And it isn't just human patients who are seeing the digital doctor. Online veterinary services are now available for cats, dogs, and other pets. Internet hospitals are expanding their range of services, but they have yet to establish a sustainable profit model.
第一个是在用户的就医心智从线下向线上迁移还是有难度的。第二个是在线上的医疗服务的解决性，就目前而言是相对有限。第三个是在支付层面，用户的自主的付费意愿较弱。其次，在医保和商保领域还未建立起完整的医疗服务的支付体系，还有包括政策的诸多影响。总而言之，互联网医疗行业还是一个比较新的行业，需要更多的空间让其更好的发展。
How to ensure the reliability and the quality of the doctor listed on the platform, and how to ensure the services is well justified, is well priced, and provides its value, the value it deserves on the platform.
The Internet Plus healthcare model that emerged during the pandemic is still evolving, and industry experts foresee continued growth.
The pandemic is a catalyst to China's digital reform of healthcare system. So it is also a test to, for the patients and the users to see how hard it is to get an online or internet hospital treatment. And it turned out it's very easy to use, right? So now people have a strong sense of the simple procedure they're gonna take. If they don't have to go to the hospital, they can simply go to the online healthcare platform. So I think sometimes it creates the user stickiness to a degree during the pandemic, and people just keep using it.
在线医疗和智能技术，它有助于帮助我们整个医疗服务体系真正形成是院内院外相结合，线上线下一体，包括覆盖用户诊前、诊中、诊后全流程的医疗服务的体系。